Hello, nursing student and future RN next generation. Welcome to the Daily Nursing Dictionary. The word of the day is aphasia. Now, it's important as an RN for you to know how to say the word properly because, well, you sound smarter that way, right? So, aphasia, no, it's aphasia. Right? And so what does that word mean? Well, it is, according to the dictionary, if I look at my Google search, it's a comprehension of communication regarding speaking or writing or reading. What does that really mean, right? Why do I care as an RN if somebody has aphasia? Well, it is very important to understand that these patients have difficulties with the language itself, which means communication is an issue here. So the number one thing that I want to think about is that what is the part of the brain that's having the issue? No, it's not really. Honestly, guys, for the nursing, you do not need to know what area of the brain is impacted by this. What you need to know is, what does this indicate? Is this a problem or not? Do I need to panic? And how much panic do I need to do? So if I find a patient who has an aphasia, I have to first, and most importantly, as you know, from day one, I will keep saying this until the day I die, is the first thing, the most important thing, the number one thing that nurses do is assess. So I need to be able to assess the level of difficulty that this patient is having. More importantly, to figure out what kind of aphasia the patient is having. Because I know the moment I pick up the phone and call the doctor and let the doctor know that the patient has aphasia, the doctor is going to want to know what kind of aphasia the patient has, and is there any other things that are important for me to assess as an RN. So most of the time, the way you're going to see the aphasia as an RN, it's going to be with your communication with the patient. And there are two different types of the aphasia. There is a sensory or receptor one, meaning all of our senses. So if the patient can read it, will that transfer in the patient's brain into something they understand? Or if I talk to the patient and they hear it, right? They get it through the sensation of the ear. Can they understand what's being said? So that is called sensory, right? All the senses coming in, or receptory aphasia, meaning the patient has an issue with the information getting into the brain. Most of the time, what are you going to see in a patient like this? Well, it's funny enough, they're going to be pretty pleasant. They don't really know that they have a problem. They're not really cognizant of the issue that they're having or what's going on. And most of the time, they're going to sound more like a dementia, Alzheimer's type of a patient, where they're just going to smile back at you and say, okay, Nurse T, everything is fine, no problems. But really, they will not be responding to your question appropriately. That it will be sensory or receptive aphasia. Now, on the other hand, we have patients who have issues expressing themselves, and that's why it's called expressive aphasia. These will be the patients that will have difficulty expressing themselves. Also, the nerves or the neurons that take care of the expressive aphasia are called motor neurons, meaning this patient can hear you if you're talking to them or if they're reading something, right? They understand the information coming in. What they have issues with is expressing themselves, getting that information out through motor nerves. So in this case, the patient is going to be angry and struggling to say the words. They know what they want to say, but the words are not coming out the way that they want them to say it. So if you would say the motor function of the tongue is not appropriate to what they want to come out. So you're going to find these patients being very angry, very upset, because, well, simply they just don't know what to do with that because they can't control their tongue. They cannot control the information that's coming out. And of course, you're going to hear it because, well, they're going to sound like they're slurring their speech or inappropriately speaking. And then the last, which is not a third type of aphasia, but is also common, it will be dual aphasia, meaning combination aphasia. Patient has both sensory and motor aphasia. That is the most difficult one. And of course, why the aphasias happens? Well, they happen usually they're due to some type of a damage to the brain. This could be coming from cancer. It could be a concussion of some sort. Maybe the patient fell on their head. And then lastly, usually and most commonly, is from a stroke or cerebrovascular accident, where we have either bleeding or lack of the blood going into the brain, where the brain tissue will then die and the patient cannot use that tissue anymore and will have a difficulty, like I said, either getting the sensation in, recepting the information, or expressing the information via motor functioning. For further more in-depth information about the aphasia, and more importantly, the nursing implication as what does this mean to you as a nurse, will be discussed in a longer version of this video. Please feel free to click on the link below to get the longer version of this video. Thank you and have a good day. See you tomorrow. Bye.